Guys, welcome to my YouTube channel, and now I am going to discuss about the causative agents for the urinary tract infection. So what are the causative agents for this are Escherichia coli. Escherichia coli means it is a E. coli bacteria, and Staphylococcus saprophyticus. This is also a type of bacteria which is causing the urinary tract infection. So these two are very much important. We will not discuss about these other bacteria because these two are very important for the common organisms these are. So next is how to prevent this infection. So the first thing we have to do is always you should clean the urethral meatus. So whenever a person is undergoing the intercourse with a new partner or some same partner, then he should wash his urethral meatus or she should wash her urethral meatus with an antiseptic. After the intercourse only they should clean it. And another tarika is cranberry juice decreases incidence. So cranberry juice is available in market, so who are undergoing this type of infection, they can have the cranberry juice because it is having the content tannin, so which is decreases the incidence of the UTI. So they can have cranberry juice or the blueberry juice also. Next, for the postmenopausal, if the postmenopausal woman is suffering from this type of disease, then they have to apply 0.5 gram of estrol vaginal cream for the 2 weeks. First they have to apply that cream for 2 weeks, and after that they have to apply it twice weekly for 8 months. So this can help them to get rid of the infection. Next is the treatment for this urinary tract infection. Most uncomplicated UTIs can be treated with oral antibiotics. So oral antibiotics are available in our pharmacy. So many pharmacy are having oral antibiotics. So which we have to choose is the trimethoprim, cephalosporin, macrodantin, and fluoroquinolone. For example, ciprofloxacin and also levofloxacin and cotrimazole, in which sulfonamide content will be there. So these two tablets are there, no, these are containing the sulfonamide, which will give additional benefit than the trimethoprim. And if they are having complicated UTI or something, they can take the mixture of the antibiotic. So the proper mixture of antibiotics are available, so we can take that also. So if the recurrent UTI are occurring, so if they are getting UTI again and again, then they have to check up for the ultrasound scanning and intravenous urography, which will give the complete graph about or X-ray about the urinary system. So we can also refer that. And if the kidney is affected, like pyelonephritis means kidney is affected, that time we have to take the intravenous antibiotic. Intravenous antibiotics means injections. So if the recurrent UTI are occurring, so if they are getting UTI again and again, then they have to check up for the ultrasound scanning and intravenous urography, which will give the complete graph about or X-ray about the urinary system. So we can also refer that. And if the kidney is affected, like pyelonephritis means kidney is affected, that time we have to take the intravenous antibiotic. Intravenous antibiotics means injections. So this is about this. From now we are completing this urinary tract infection topic. So thank you guys. Bye.